Hey everyone, how's it going? Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. Hopping on here to do episode 2 of the Knee to Know show. So, for today's episode, we're going to talk about calf pain after knee replacement surgery. So, I'm here, got my Stony Brook hat on, Stony Brook Physical Therapy. My alma mater where I went to for physical therapy school. Just went for a nice little run here. We're in the middle of all the COVID pandemic and all the shutdowns and everything going on, but we can still use this time to be productive, use this time to help you out and help you have a successful journey through the knee replacement process. So, a really common thing that I hear about and am asked about is calf pain after knee replacement surgery, having a lot of that feeling of stiffness, feeling of it being very heavy and full, and just overall very painful. And a lot of pressure is something else I also hear mentioned as well. And the reason for this and the cause for this, the simple answer is we're not really sure. And also, there's a lot of different factors that play a part. So, just with any type of pain, any type of discomfort or symptoms, there's always more than one specific thing that's causing it. There's all sorts of different factors, different things that play a role. And one thing, of course, is that, look at the proximity of the calf to your knee and the muscles of your calf. A lot of them are going to attach up right where you've had the new components of your knee replacement put in. So just how your knee and everything around your knee joint is very sensitive and is in a lot of pain and discomfort from the trauma of your surgery, it's very common and very expected for some of that pain to radiate or refer down into the calf a little bit, just from the circumstances of having a very significant surgery done to that area and to your leg. But a couple other reasons, or a couple other hypothesized reasons for why you get this calf pain and discomfort after knee replacement surgery is, so one, after knee replacement surgery, your muscles are very weak. Your muscles are weaker than when you went into surgery for a couple of different reasons, but one, of course, is being that those first few days, that first couple weeks after surgery, you're not as active. So those muscles are getting deconditioned and you're losing strength over time by not being as active after surgery as you heal and recover. You're also losing strength because of swelling. So swelling actually causes inhibition of your muscles. So your muscles aren't able to contract as regularly or as strongly when there's swelling in an area. And of course, this is very prevalent with your quadricep muscles, those big muscles of your thigh as well. And those are probably the most mentioned and most talked about ones, is those muscles of your thigh, the quadriceps, and how they're definitely deconditioned and weak after knee replacement surgery. But all the muscles of your leg are actually weaker and deconditioned, especially and including your calf muscles. So that's one part of it. And then the other thing to think about is you have all this swelling, and with swelling is really just fluid. And fluid is going to travel wherever gravity tends to let it travel to, or tends to encourage it to travel to. So when you're up and standing, or you're sitting up in a chair, or whatever it may be, there's going to be that effect of gravity pulling that fluid and pulling that swelling that was in your knee and around your knee joint and in your thigh and wherever, pulling that swelling down, lower into your calf, into your feet and ankles. So that's why there's one reason why there's a lot of swelling in your calf and lower leg after surgery, is just because of the effects of gravity is pulling that down, since a lot of times you're spending a lot of time up on your feet. So this creates kind of this perfect storm. So you have muscle weakness, and then inhibited, deconditioned muscles, and then you have this swelling. And what happens with swelling is it causes this expansion of your tissue, of your muscles and your skin and your everything that's superficial. So everything that's closer to the outside, closer to that layer of your skin and your dermal tissue that's going to be expanded because of the swelling. And then what's going to happen is the deeper tissues, the deeper structures, so your muscles, most notably, and your fascia and your tendons and all the connective tissue, that deeper, those deeper things, they're actually going to be compressed. And they're going to be compressed from that swelling because, well, there's only so much space within your leg for there to be things. So the swelling is going to take up space, and it's going to cause that compression on the lower structures, your muscles, your tendons, and any other soft tissue. And that compression is where you get that sensation of tightness, of fullness, of pain and discomfort. So that's kind of the general understanding and the general thinking of why do you have this calf pain and why is calf pain so common after knee replacement surgery. So what are some things you can do about it? Well, the one thing you can do, and probably my biggest recommendation, is strengthening or muscle contraction. So you want to move the muscles. So moving the muscles and moving the soft tissue is going to help activate that pump, and that's going to help pump the blood, pump your fluid out of the leg back up towards the central parts of your body and your heart, and starts to flush it out and recycle it and renew it. So the main way to do that is muscle contraction. So doing exercises that work the muscles. So probably the most straightforward and the easiest one, easiest conceptually to do is heel raises. And so heel raises is, pretty self-explanatory. You stand up and you can have, something to hold on to, something sturdy like a counter or a windowsill or, a tabletop, whatever it may be. And you are starting flat-footed, and then you're lifting your heels up, so you're standing on the balls of your feet and your toes, heels raised, and then come back down nice and slow. And you can progress this pretty easily. So you can start by doing 2 legs, so heel raises with 2 legs, going up and down at the same time with both legs. And then the next way you can do that is to progress to single leg heel raises. So now going up and down with just the one leg, nice and slow and controlled all the time. And then another way to progress this is to go what we call eccentric heel raises. So eccentric heel raises, all that's really meant by that is now you're really focusing on not the upward portion, but actually that coming down portion. So you want to go, when you come down from the heel raise, you're going down as slow as you possibly can, taking a good couple seconds to come all the way down, and really emphasizing that eccentric portion or that lowering portion of the exercise. And so you can go from initially concentric focused, so focusing on that up portion, so doing the up portion, and then you can do eccentric, which is up and then very slow all the way down. And that's all that really is doing, among other things, is it's really increasing the time that the muscle is contracting and working, time under tension we call it. And that's going to help, one, strengthen the muscles up that are deconditioned and weak, and it's also going to help to pump that fluid a little bit more. And also strengthen the tendons and ligaments of your leg and of your calf muscles as well. So that's the ways to do it. And then the last thing is to consider doing heel raises just from the floor, so from a flat surface. And then as you can tolerate it, you can try doing it from a step. So having the heel of your foot actually off the edge of the step. So that way you're starting in almost this stretched position, and then you're coming all the way up and all the way down. And what that does is it provides a little bit of a stretch at the beginning, and it also helps you go through an entire range of motion. But that would probably be the last progression that I would take someone through. It's a little bit more stressful, can be a little more uncomfortable and difficult to do. So that's one main thing, is just exercises and strengthening those muscles. And then the other thing that you can focus on is just gentle type of stretching. So gentle stretches, there's different arguments, pros and cons about stretching and should you stretch, should you not stretch. I've found clinically a lot of times just doing some gentle, easy stretches can help to relax the muscles, help to calm down the nervous system, help to just feel a little bit more comfortable and not have that tension and tightness. And one of my favorite stretches is, we call it the wall stretch. So basically you're putting your hands up against a wall and then you're putting, going into this staggered stance. So 1 foot forward and 1 foot back. And then you're keeping that back foot, keeping that whole foot flat on the ground, keeping that heel flat. And you're just leaning forward into the wall until you start to feel that gentle stretch, that gentle pull along the back of your calf muscles. So that's another great way. And then also, it's definitely okay to incorporate some, little bit of soft tissue massage, doing gentle massage, maybe with a foam roller, maybe with a massage stick, a lacrosse ball, whatever it may be. What this is doing and what this is causing to occur on a physiological and an anatomical level, is definitely debatable. But a lot of times, just this simple thing, just like the stretching, can really help to calm things down, calm down any symptoms, any pain or discomfort, that feeling of stiffness and tightness that you might be feeling. A lot of times, just doing some gentle massage can really be beneficial and help you feel a lot better. All right. So those are kind of my reasons, one, why we get that calf pain or why we think we get calf pain, and people get a lot of calf pain after surgery. And then also just a couple different things that you can try out to try to reduce and decrease that pain and symptoms in your calf and that region. So thank you very much for watching, everyone. Of course, if you have any questions, leave a comment below. I'll get in touch with you and try to help you out. I appreciate you watching. Stay tuned. We're going to keep this rolling. One brief 10-15 minute video most days, every day, hopefully, to really help you guys all out, help you get the most benefit and have a successful knee replacement journey wherever you are in that journey. All right. Thank you very much for watching, everyone. This has been the Knee to Know Show. I'm Dr. Luke Peterson, physical therapist with the Knee Replacement Therapist, and I'll talk to you all sometime soon. Take care.